or a non-steroidal anti-inflammatory. It will be having its action on the bloodstream, and next level will be on the particular area of its action. Then, if you're going with the Ayurvedic management, say for you're having an injury over this part, which you had almost similar injury over your back due to an invasive procedure, and what we'll be doing is actually we're having a typical or a specific application of drug or medicine over that particular area. It's called the labana or the paste application, which includes the drug mainly. It can be a raw drug or it can be a dried drug, dried, which can be a root or bark or with some more than 10 tubes or 10 types of medication, which will be grinded up and it will be mixed with a specific liquid, and it will be boiled up and it will be applied over that particular area in a little warmth. Then that that application itself, which is a medicated application, it will be having its specific medicated action within that area, within that group of muscle. We'll be starting it from the insertion of the muscle to its attachment. So the whole muscle will be taken care of. And then what we'll be doing is actually making the muscle immobile with a bandage. The whole procedure can be described as Ubanaha in Ayurveda, or it can be a paste application along with the supportive bandage. So what the medication will be doing is reducing the inflammation over that localized area, and what the bandage will be making the muscle group immobile so that it will be healing by itself. Along with that, we'll be giving the medication, the herbal medication, which will aid up the healing. So the protocol which we are doing in Ayurveda is actually a little different from the modern medicine, but it's actually a logical scientific thing, and it's all on the basis of a logical thinking. That means the partial immobilization application of the face, and the duration of the similar treatment won't be there for one day. It will be there for 3 days or 5 days or 7 days. When the patient feels better and we feel that the signs and symptoms are relieved, then only we will be removing the paste application. But again, the paste application will be there for maximum 1.5 or 2 hours per day. Sometimes it can be 2 times per day, depending upon the patient's condition.
And so this paste application will help removing the inflammation. And in the other treatments, the Ayurvedic food or other treatments you do, is there something else that will help with the inflammation?
Yes, definitely. Systemic support. This is actually the localized support which we are giving, and this localized support will be there for the muscle, the soft tissues, and the nerves also, the peripheral nerves. But we need a systemic support also. For that systemic support, we mainly advise patients to have the decoctions, mainly called the kashayams, which is actually a combination of many drugs, along with Ayurvedic medication, internal medicines. And all the medicines are herbal. And since it's herbal and the combinations are, say for 5,000 years old combinations, it have proved by itself. Since last 5,000 years it's been using.
So the kashayan is the one so you have external and
internal medication along with the dietary regime. Sometimes while using the kashayams and internal medicines, there should be some restrictions. There should be some restrictions in food. Mainly, heavy diet won't be advised. That means heavy means you'll be taking a lot of protein. Definitely, meat is a protein. As you all know, meat and oil will be having always a heavy diet. So, we at Ayurveda, during the time of treatment or during the time of internal medicines, strictly advise the patients to be vegetarian. It doesn't mean that Ayurveda is vegetarian. Ayurveda is practicing vegetarian during the time of treatment. But since it's vegetarian means less proteins are there, but easily digestible one, so that the medicines will be very easy to get digested, and the systemic relevance of the medication will be there.
Okay, so the meals will be lighter so that the medicine that are taken in can work better.
Yes, that's an important thing. The meals are lighter and certain foodstuffs will be avoided or should be avoided to increase the efficacy of the treatment. That's all. Anything else?
So that was regarding the inflammation. And as well regarding, I could feel that I had like an iron hand around the damaged area. And after the first treatment and after each treatment, I felt like the hand was loosening. And of course, I understood it was the muscles that would relax. And from what we know, in the old times, the soldier, the injured person, they had time to heal.
Yes.
And nowadays it's getting really difficult because you just need to get back right away.
Yes.
You don't have the time to heal. So I could notice during my Ayurvedic treatment that it was a huge advantage for.
Yes, the importance of rest. What you are hinting me is of the importance of rest. Definitely, what all Ayurvedic treatments are doing is actually mainly with relevance with now we are actually discussing regarding the musculoskeletal disorders. So regarding the musculoskeletal disorders, all the Ayurvedic protocols which are there are actually loosening up the muscles because say for if you have an injury, definitely it will be an inflammation which will make the body's defense mechanism to protect by itself by making it more immobile. That means if a person becomes immobile for a lot of period of time, definitely the muscles group will be stiff. That means stiffness will be there. So inflammation, immobility, stiffness, which make the joint a little stiff. So what all treatments we will be having are mainly for reducing the stiffness. Yeah? So all the treatments mainly heat therapies. What these heat therapies will be making is actually it will be relaxing the muscles.
So that's the hot oils.
Yeah, hot oils,
hot water to drink.
Yes, all the treatments, even the Panchakarma treatment of the Vasti, it is actually the number one muscle relaxant. So almost all the treatments for musculoskeletal disorders are mainly to relax the muscle. Relax the muscle during the relax when the muscle is being tortured for 7 days with heat, it will relax. Then
so this is all traumatic injuries basically.
Yes, it's definitely because almost all the musculoskeletal diseases, almost 75% will be mainly due to some sort of trauma. It can be due to a fall, it can be due to an invasive injury, it can be due to a fracture. Only few will be having some infective origin. But mainly with all the musculoskeletal disorders, almost if the patient needs